My name is Jackie, and I'm reporting on Prader-Willi Syndrome. Prader-Willi Syndrome is a genetic disorder characterized in infancy by diminished muscle tone, feeding difficulties, and failure to grow and gain weight. In childhood, it is known as thriving too well, and it has features that include short stature, genital abnormalities, and an excessive appetite. Progressive obesity results because of a lack of feeling satisfied after completing a meal that leads to overeating. Without appropriate treatment, individuals with severe progressive obesity may have an increased risk of cardiac insufficiency, diabetes, or other serious conditions that may lead to potentially life-threatening complications. All individuals with Prader-Willi syndrome have some cognitive impairments that range from borderline normal with learning disabilities to mild mental retardation. Behavior problems are common and can include temper tantrums, obsessive-compulsive behaviors, and skin picking. Other characteristics include delayed psychomotor development, hyperphagia or binge eating followed by purging, short stature, small hands and feet, and obsessive-compulsive behavior. Prader-Willi syndrome can be helped by weight management, growth hormone, physical and occupational therapy, sex hormone replacement, behavior management, and psychotropic medication. Crucial to the development of a child is their involvement in early childhood intervention. This alone can help the child reach their individual full potential. Prader-Willi syndrome is a complex non-hereditary birth defect resulting from an abnormality on the 15th chromosome. It occurs when the genes in the specific region of chromosome 15 do not function. The abnormal genes usually result from random errors in development, but are sometimes inherited. The prevalence estimates have ranged from 1 in 8,000 to 1 in 25,000, with the most likely figure being 1 in 15,000. It occurs in males and females equally and in all races. Incidence in newborns is unknown. The diagnosis of Prader-Willi syndrome is done by diagnostic testing. The genetic cause is the loss of an unidentified genes normally contributed by the father. Prader-Willi syndrome occurs from 3 main genetic errors. Approximately 70% of cases have a non-inherited deletion in the paternal contributed chromosome 15. Approximately 25% have 2 maternal 15 chromosomes and no paternal chromosome 15, and 2 to 5% have an error in the imprinting process that renders the paternal contribution non-functional. Prader-Willi syndrome is determined and diagnosed through diagnostic testing. Individuals who have a number of the clinical findings should be referred for genetic testing. DNA methylation analysis confirms diagnosis of Prader-Willi syndrome. DNA techniques can identify the specific gene, the specific genetic cause, and associated recurrence risk. Some implications in early childhood intervention would be to watch eating habits, monitor them very closely. This will help with the struggle with obesity and the lack of feeling full. Also, physical and occupational therapy can help improve movement in the child and help define and tone muscle. The child can also undergo both sex hormone and growth hormone to improve the size of their limbs and extremities, as well as help build testosterone or estrogen that is needed for the body to reach its full potential size and stature. The child may also be placed on psychotropic drugs to help with any obsessive-compulsive behaviors. And lastly, the child may be able to go through behavior management to help the child cope with everyday life. These things are things the child will learn through early intervention, and are crucial items that those involved in this intervention need to keep in mind. The following resources provide critical service, vital information, and clearly defined answers to help people who have been diagnosed with Prader-Willi syndrome, or those who know someone who have been diagnosed with Prader-Willi syndrome. There's a Prader-Willi Syndrome Association USA at www.pwsausa.org, the Foundation of Prader-Willi Research at www.fpwr.org, ARCA Opening Doors at www.arcaopeningdoors.org. There's also the Prader-Willi Alliance at www.prader-willi.org, and then the National Organization of Rare Diseases at www.rarediseases.org. To become informed on Prader-Willi syndrome and to stay updated on Prader-Willi syndrome, you should look at a lot of these websites and a lot of other ones.